I'm quite honored to be here tonight. I really appreciate what the Epilepsy Foundation of Greater Los Angeles is doing, and I hope that I can educate you on some controversial topics here, but hopefully you can leave here tonight understanding that this is and should be an option for anybody who is suffering with intractable epilepsy, because it may be something that actually changes their lives. So I'm going to go over a little bit of the history of cannabis because it's interesting, you know, most of us grew up with cannabis being illegal. And what's amazing is that it's been around for thousands of years, and it was commonly used as medicine for many, many years. It's only been illegal now for about 80 years, and prior to that, people did use it as medicine. In 1841, a physician from Great Britain went to Asia and India where it was being used, and he watched people using it, and he realized that it was really not that harmful, and he saw people getting benefits from it. And remember, at that time, there were no pharmaceuticals around. And so he was the one who was responsible for bringing medical cannabis from the eastern part of the world to the western part of the world. And he brought it back to Europe, and in Europe it became a common medication. Between the years of about 1840 to 1900, there were over 100 medical reports documenting the medical uses of cannabis. And most of them did state that, of course, that it was very safe. Now you can see the bottle there, that's from 1928, and cannabis was one of the top 3 prescriptions that was written in the United States prior to its illegality. And it was commercially available as either a tincture, in alcohol base, sometimes in oil, and also it was available as a salve or a balm. And it was really prescribed by doctors until about 1937, when propaganda began against hemp and against cannabis. And I love this poster, Reefer Madness. You know, it makes you look like you're crazy, right? But there was a government crusade against hemp, and it really was not based on the science, because at the time they really didn't know the science. And so most of it was based on financial and cultural issues. There was a Marijuana Tax Act that was passed, and physicians were discouraged in that act to prescribe cannabis. It put a large tax, and paperwork became very difficult, so doctors started to switch over to the few medications that started to be available. In 1941, that was when it was all shut down. The US drug formulary dropped it as a medication. Now we fast forward to 1970s when everybody was using cannabis. At that time, 1960s, 1970s. I don't have to remind you what went on at that time. And at that time, as Andrew said, cannabis was placed in a Schedule I category. Schedule I means no medicinal value, lack of safety, and high abuse potential, and we know that is not true about cannabis. Now, if we go a little bit further here, in 1964, there were Israeli researchers that were very interested in studying natural plant medicines. And one of the scientists was Dr. Raphael Mechoulam, who still does cannabis research today. And what he did was really important, because at the time, nobody really knew what part of the plant actually caused the psychoactive effects. And so what he did was he was able to, using, you know, not very sophisticated machinery, he was able to separate THC and CBD. CBD is cannabidiol. And what he did was he had 2 separate extracts, and he was able to give THC to young, healthy volunteers, and they felt the high, and he was able to give CBD to young, healthy volunteers, and they didn't feel anything. And so clearly it was THC that caused the psychoactive effects. That's what they were looking for. And then the research with THC began, and people basically ignored CBD. There were a few studies throughout the 70s, early 80s that looked at cannabidiol, and there were some studies that actually looked at cannabidiol like in 8 people with epilepsy to see if it helped. However, there was really no research being done, and again, because of its illegality. Now, if you can see the structures, you can see THC on the left and cannabidiol on the right. You can see that they're both very closely related. There's really only a few changes. And so what's fascinating is that there's teeny tiny changes in its molecular structure, but completely different effects. Now, in 1988, that's when the real research, the big discovery happened. And what happened at that time was that, I don't have a pointer, so I apologize, but on the top purple blob, can you see that? There's a little receptor, it's labeled cannabinoid receptor. At the time that they saw that, they did not know what that receptor did. They called it an orphan receptor. And they were looking to see how THC worked in the body, and scientists took THC and labeled it with radioactive dye, and they followed it. And lo and behold, it went to that orphan receptor. And they tried other chemicals at that receptor, but nothing else worked at that receptor. And a receptor is like a lock and a key, and I'll show you that mechanism in a second. But what they realized was that THC, each and every time, went to that receptor. And so what they labeled that receptor was a cannabinoid receptor, because that's the compound that it would bind to. These scientists were really smart, and they said, we do not have a receptor in our brains and in our bodies for a plant. We must make something. We are designed to be kind of self-automated, right? So they went in search of, and in 1992, scientists found what they call now the first endocannabinoid. And endo refers to like endorphins from within, so they labeled that endocannabinoid. You make a cannabis-like substance that binds to those receptors. Some people think it's a design, that we're designed to have this. Some people think it's a quirk of nature. As a scientist, it's just there, and we can use it as a target for treatment. Oop, there we go. Now, this just shows the lock and key mechanism, and this is how receptors work. For the endocannabinoid system, it's basically three parts. There's the receptor that sits on the cell wall that I showed you in the last slide, but then there's the chemical that binds to the receptor, and in this particular receptor, the cannabinoid receptor, it will bind to the plant cannabinoid or to the human-made cannabinoid. And then there's a third part to this system, and that's the enzyme that comes along and breaks down the cannabinoid, the chemical that's binding. Now, as you can see in the picture there, the brain chemical, which is called, the first one they found, the first endocannabinoid, and there's 5 different ones that they have found so far. The first one was called anandamide. And you can see that as it folds up in a 3D structure, it looks exactly like what THC looks like. And the endocannabinoid system, after these discoveries in 1988 and then 1992, there was a lot of interest in this receptor, figuring out what it did. And we found out that the role of the endocannabinoid system is huge in every physiologic process in our body. It is the most widespread receptor system that we have. And as you can see from this list, memory, appetite, energy, and metabolism, we see on here the last thing, homeostasis, which is balance. This part of our brain and part of our body is responsible for us staying even. Right now, as we're sitting here, the system is working in all of us, and it is balancing the way we react to our chemical messages that are being sent in our head. And what's interesting is this last part says ECS controls the overexcitation of cells, and that's where the role for epilepsy is so important. Now, this slide is a little complicated, so bear with me if I had a, I'm going to just try to describe. The blue cell on the top is a neuron, and it's talking to the pinkish neuron at the bottom. And on the right-hand side of that, you can see little purple circles. Those are your neurotransmitters, serotonin, dopamine, these kinds of things. And what they're doing is the top cell is sending a chemical message. Excuse me, put my glasses on. And the chemical message that's being sent depends on what cell the message is coming from. But what's happening is that top cell sends the message, and the bottom cell, what we call the postsynaptic neuron, receives that message and then is supposed to pass it along to the next cell. In a brain that is functioning normally, if that message is off, without you knowing it, your body is making your little marijuana-like substances, and they're represented here as the little green triangles. Your body's making those and sending back to the receptor, which is the squiggly line on the top cell. And it's basically telling the cell, fix the message is off. And you can see in this particular cell, you see there's a negative sign there from the receptor to the neurotransmitter. And what it's doing is it's saying, turn down the volume. Turn it down, turn down the neurotransmitter message. And what we know is that in people who have epilepsy, that neurotransmitter message is overexcitation. It's too much message being sent. And so what happens is that the endocannabinoids are supposed to dial it down. And as I'll show you, there appears to be some compelling evidence that shows that people who have epilepsy may have dysfunction within this system. And if we target this system with cannabinoids, which would come from the plant, then we can kind of substitute what the body might be missing, okay? I love the quote at the bottom. It's like my favorite, and the people who saw me speak last night heard me say this too. The endocannabinoid system is essential to life, and it relates messages that affect how we relax, eat, sleep, forget, and protect. And part of the protection is to protect the machinery that's supposed to be balancing in the brain is supposed to protect us from seizures. And it may be such that, as the evidence is showing, is that a dysfunction in the system is what can contribute to seizures. Now, the location of the cannabinoid receptors are really important. There's receptors in your brain and there's receptors in your body. And if you know anything about medical marijuana, you know that people are using it for pain, they're using it to help with nausea and vomiting, they're using it to feel better. And as you can see, where are the receptors located in the brain? The pain part of the brain, emotion, memory, learning, appetite, motor coordination, nausea, vomiting, pleasure, and reward. And if you'll notice in the body, it has a lot to do with, the receptors are located in the immune system, the GI tract, and in certain other areas. I see a lot of patients in my medical practice who come in with Crohn's disease who find great relief. And why is that? Well, there's a lot of receptors in the gut that respond, that may be off, maybe not sending the right message. I see patients with autoimmune disease. Why does it work for them? Again, because that's where those receptors are located. Be aware there's no cannabinoid receptors in the area of the brainstem where heart rate and respirations are controlled, and that is why we all know you can overdose, as Maureen Dowd documented in her New York Times article, but it's not fatal. You will feel better eventually. Now, what's interesting is that with research, they found that these receptors are not, you're not just born with some. You're born with some that can change. They can pull into the cell, you can express more, and it appears that when you have disease, your body makes more receptors. It's as if your body is saying, where's the cannabinoids? I need more, I need to go into balance. And so what they have found in a number of studies, and most of these are done in animals, that the receptors upregulated just means you have more. So there's more receptors that are expressed in a part of the brain called the hippocampus when seizures are present. The receptors are upregulated in patients with Crohn's disease. They're upregulated in chronic, what's called neuropathic nerve pain. They're upregulated when you take rats and you sleep deprive them. Guess what? They're out of balance and they get more receptors. And last year they actually showed that white blood cells, remember, part of your immune system, that children with autism actually express more cannabinoid receptors in their white blood cells. And this appears to be a protective mechanism. Your body is trying to ask for more cannabinoids. Now, again, I mentioned already there's compelling evidence that endocannabinoid system dysfunction promotes seizures. There are a lot of studies. Most of them are done in animals and in the laboratory, and that is because a Schedule I drug, you are not allowed to do studies in humans. You may study the detrimental effect, but you are not allowed to study any benefits. It's a real problem that cannabis is still in a Schedule I, and if we could get it moved to a Schedule II, we can actually get real research going, and that would be important. But we do have some studies, as you can see here, that in one study that was done in 2003 by Wallace, cannabinoids stop seizures when you block that receptor, so you actually kind of cover it up so the cannabinoids can't bind there, it actually provokes more seizures. It actually provokes a persistent seizure state. So that receptor is very important to the balance. They also found in that study that the animals in the post-mortem exam had increased receptors as well. Another study, you could see the second one there, again done in 2003, showed that one prolonged febrile seizure changed the way your endocannabinoid system worked. And we know that children who have febrile seizures are at increased risk for having seizures later in life as well. And the very last study here that I put up, and again, there's others, but I wanted to pick out some ones that really show how important this system is. When they took brain tissue from someone who had it surgically removed because of seizures, and they compared it to postmortem tissue from someone who died of natural causes, they found that the surgically removed tissue had 60% less endocannabinoids. So that is actually in humans. And so it's obvious that there's a deficiency in the endocannabinoids that someone might be making. Now, CBD or cannabidiol has been shown to have what we call neuroprotectant qualities. It is an anti-inflammatory and it's an antioxidant, and that's been proven over and over again. That research exists. But they've taken it a step further, and they've actually used models of Alzheimer's, Parkinson's, alcohol-induced brain damage, head trauma, stroke. Hypoxia is when you cut off oxygen. Ischemia is when you cut off blood flow. And if you do that in an experiment and then give CBD after, it actually protects the brain from the damage that would normally be there without CBD. And that's pretty impressive, because you don't have to give it before, you can give it after the injury. There's also evidence that CBD actually helps brain cells grow. Again, this is in animal studies, and that's what we call neurogenesis. And this is a part of the brain that has the potential to grow new cells, and CBD has been shown to help promote that growth. Now, it's interesting because I keep talking about the receptor, and it turns out that THC works at the receptor, but CBD doesn't. But CBD does modulate what's going on at that receptor, and it also has many other roles. And if you look at the list here, it works in ion channels, it works at what we call receptor independent, not at receptors. It also happens to block the uptake of your body's natural endocannabinoids. If you make those cannabinoids, your body breaks them down right away. CBD actually makes them last longer in your body, so that increases the endocannabinoids at the receptor. There's a lot of research into CBD, and it's being done all over the world, not just here in laboratories, but it's being done in Europe and in Asia and in the Middle East, and we're really starting to see more and more studies. If you look over the past few years of how many studies on cannabidiol are out, since the year 2000, it's increased exponentially. Now let's move on to what the plant is about. Okay, we've all kind of heard about this plant. The plant has over 400 different compounds in it. It is not one medication, it is many. Species specific to the cannabis plant are what we call the phytocannabinoids. Phyto refers to plant, cannabinoids refers to those compounds that bind at the receptor. There are 85 and more different phytocannabinoids in the plant. Everybody's heard of THC. CBD, cannabidiol, is the second most common, and then all the other ones kind of add up as minor cannabinoids, but it's all of these cannabinoids together that have a role in treating. Now, there's other compounds in the plant that are cross-species. There's essential oils, which I'm going to talk about a little bit. That's what gives cannabis its distinct aroma. There's over 200 different oils in the plant. And there's also something called flavonoids. And there's about 20 different ones. Entourage effect means all of those cannabinoids working together. Now, in the plant, it's very important to understand that all marijuana plants are not created equal. Some plants are high in THC, some plants are high in CBD, and as you can see from this chart, there's one compound that has 2 assembly lines. And so you can actually point the plant into 2 different, genetically different types of result. So what's being used now are plants that are going down on the right. They're being genetically determined to go towards CBD. Here's the different effects of these plants. Of these cannabinoids. You can see THC is psychoactive and has a whole bunch of medicinal value. CBD also has a lot of medicinal value as well. And as you can see, though, the number one difference between the two is one makes you high and one doesn't. I'm going to fast forward here because Andrew's telling me to wrap it up. So I'll move forward here. I just want to kind of go over one other thing. There is an FDA trial going on right now in this country for a drug that has been made by a pharmaceutical company in Great Britain. And you all should be aware of this because this is going to give us a lot of value so that we can see what CBD is doing. And then I'm just going to add one other thing. Out of Colorado, you all may have heard about the Stanley brothers, and one of the Stanley brothers is here tonight, Joel. Out of Colorado, the kids who are getting CBD oil, which they take under the tongue, or they take it by mouth, or it's put through a G-tube, they're seeing 85% of the kids taking that are getting seizure reduction. In my practice, yep. In my practice right now, I have 63 children, or people under the age of 25 on various types of CBD oil, and I'm seeing 75% reduction of seizures and about 8% seizure-free. And that is pretty impressive, if you ask me. So I do have to show one last slide. These are some of the kids I take care of, and this is what keeps me going. Thank you. Thank you so much.